Hi, my name is Evan Ciccarelli,
Hi, my name is Kristen Cinco.
and today we're going to be exploring two different therapeutic paradigms, the cognitive behavioral therapy paradigm and the psychodynamic or psychoanalytic therapy paradigm. And basically from this, what we want to do is we really want to establish like a dichotomy between the two. We want to make it very clear the differences, we want to make clear the similarities, and to do that, we're going to be looking deeply into these different case studies. We have one case study for cognitive behavioral therapy, one for psychodynamic. And then we're going to be doing a little comparing and contrasting and making up our own theoretical examples. Okay? So we can read this here. I'll start. I'll be the therapist. You can be the client. And for the next one, we can switch our roles. Okay? So Jill, a 32-year-old Afghanistan war veteran, has been experiencing PTSD symptoms for over 5 years. She consistently avoided thoughts and images related to witnessing her fellow service members being hit by an improvised explosive device, IED, while driving a combat supply truck. Over the years, Jill became increasingly depressed and began using alcohol on a daily basis to help assuage her PTSD symptoms. She was waved the second truck forward, the truck that hit the IED, while she and her fellow service members on the first truck worked feverishly to repair it. Okay, and then we'll start this. Can you tell me what the protocol tells you to do in a situation in which a truck breaks down during a convoy?
You want to get the truck repaired as soon as possible because the point of a convoy is to keep the trucks moving so that you aren't sitting ducks.
Okay, that's helpful for me to understand in light of the protocol you just described and the reasons for it. Why do you think you should have the second truck wait and not have them go on?
If I hadn't have waved them through and told them to carry on, this wouldn't have happened. It's my fault that they died.
It is certainly sad they died. However, I want us to think through the idea that you should have had them wait and not had them go on, and consequently that it was your fault. If you think back about what you knew at the time, not what you now know not what you know now 5 years after the outcome, did you see anything that looked like a possible explosive device when you were scanning the road as the original lead truck?
No, prior to the truck breaking down, there was nothing that we noticed. It was an area of Iraq that could be dangerous, but there hadn't been much insurgent activity in the days and weeks prior to it happening.
Okay, so prior to the explosion, you hadn't seen anything suspicious?
No.
So, in light of the facts that you didn't see anything at the time when you waved them through at 200 yards behind, and that they obviously didn't see anything 10 yards ahead before they hit the explosion, and that the protocol would call for you preventing another danger of being sitting ducks, help me understand why you wouldn't have waved them through at the time. Again, based on what you knew at the time.
I hadn't thought about the fact that Mike and the others obviously didn't see the device at 10 yards, as you say, or they would have probably done something else. Also, when you say that they were trying to prevent another danger at the time of being sitting ducks, it makes me feel better about waving them through.
Can you describe the type of emotion you have when you say, "it makes me feel better"?
I guess I feel less guilty.
That makes sense to me. As we go back and more accurately see the reality of what was really going on at the time of this explosion, it is important to notice that it makes you feel better emotionally. In fact, I was wondering if you had ever considered that in this situation, you actually did exactly what you were supposed to do, and that something worse could have happened had you chosen to make them wait.
No, I hadn't thought about that.
That's okay. Many people don't think through what could have happened if they had chosen an alternative course of action at the time, or they assume that there would have only been positive outcomes if they had done something different. I call it happily ever after thinking, assuming that a different action would have resulted in a positive outcome. When you think, I did a good job following protocol in a stressful situation that may have prevented more harm from happening, how does it make you feel?
It definitely makes me feel less guilty.
That seems really important for you to remember. It may have been helpful to remind yourself of what you have discovered today, because you have some habits in thinking about this event in a particular way. We are also going to be doing some practice assignments about this event in a particular way. We're also going to be doing some practice assignments, challenging question worksheets, that will help to walk you through your thoughts about what happened during this event. Help you to remember what you knew at the time and remind you how different thoughts can result in different feelings about what happened.
I actually feel a bit better after this conversation.
Okay, so after reading that and experiencing that different dialogue that was going on between the two, actually, let me do it this way. I would like for you, as soon as I open it really quick, oops. I would just like for you to fill in three main ideas that you could derive from that case study. Main ideas not about the actual specifics of that specific person's therapy, but about the type of paradigm cognitive behavioral therapy is as a whole after reading that.
Okay. So, one thing would be, challenging cognition. So, the therapist has her think back to everything that happened, and instead of thinking about what she did and how that makes her feel guilty, she showed her how what she did was the correct thing to do, and how if she hadn't done that, things could have been a lot worse. So instead of just having her talk about how she felt necessarily, she helped her kind of change how she was feeling by helping her realize her thoughts about the event weren't as correct as what actually happened.
Okay. And then, so I think that's a very good point that really is ubiquitous in the entirety of CBT. So what would be another thing you could derive from that?
There was a change in behavior. So at the end of the dialogue, she said that she felt better and she felt less guilty after having the conversation. So I think that it was important to show that after thinking about things in a different way than she had been helps her.
Okay. So a change in behavior resulting from the change in cognitions.
Mm-hmm.
I think that's a very important point that you made. I agree with that entirely.
And then the last thing I would say is the homework assignment that she has her do, because it'll help her kind of go home and think about all events in her life differently rather than just fixing the one event that was bothering her. She can apply that to other things and kind of help her way of thinking and help her feel better about things.
Okay, these are three really great points. I think that really does encompass cognitive behavioral therapy and really lends credence to the idea of looking at case studies, and shows the importance of case studies and what they can do for a student learning. So basically, I just want to repeat that, but this time with a different case study that's in the psychodynamic paradigm. Excuse me. Sorry, I just opened the same one. Let's just close this out. Open this up. All right. So this time I'll still read this part, but you could take the role of the therapist and I'll be the client.
Okay.
So ours is the case of a lady we should call Amelia, about 35, married, and the mother of a 10-year-old. She works for an important company in X, it's not specified. The woman complains of a troublesome symptom, persistent insomnia. Persistent as it defies any kind of conventional treatment. Night after night, I make desperate efforts to sleep. She succeeds toward dawn, when actually exhausted, she finally falls asleep. To her sleeplessness, there adds a weird mood of apprehension and an uneasiness that psychoanalysis used to call anxiety.
What brings about this condition?
Something like an anticipation, as if I were expecting something and were not sure what.
Would you please try to remember some circumstance when you experienced the same thing? I insist.
Exams, maybe, when I was at school, or Christmas Eve, rather, when I used to wait for Santa. Or why not, when I would plan a trip or a celebration and would eagerly count every minute to it.
Any trouble at work? I ask. Any tests, exams for a higher position, or things like that?
The client responds that no, there's nothing special. Amelia references the economic standing. The therapist asks Amelia about her economic standing to figure out just about how much they make. And Amelia adds, you know how it goes, the more you have, the more you want. It then goes on to say that it's anxiety that Amelia's issues are concerning. These are the thoughts of the therapist and what she thinks regarding why Amelia can't sleep at night. Anxiety being a major component and a major target of this type of therapy. So let's go ahead and start from here.
Do you happen to have a dying relative? Are you looking ahead to some inheritance?
The answer was immediate, betraying Amelia's bewilderment. Yes, it's my uncle, she assured me. He's over 80 and he's awfully rich.
Are you his heir?
His one and only heir, she specified.
Your case is solved then, I replied. Your eagerness to get the inheritance is to blame for both your insomnia and your anxiety. Given your uncle's age, you think the long dreamed of moment for getting your heritage is drawing nearer by the day. Hence your anxious anticipation and sleeplessness, betraying your wish for this moment to arrive as soon as possible, just as you used to eagerly wait for your Christmas presents.
Okay, all right, so that one is a little shorter, and that's going to end that. So the next thing I would like to do here is really just repeat the previous assignment, but this time I would like to do it for, of course, that case study. So that one is up here. And same thing, just if you could extract from that case study 3 main ideas regarding this paradigm of therapy, what would they be?
I would say the first one would be memories. So the therapist asks her to explain if this has ever happened before and with what. So she says how when she was little she used to have some anxiety and anticipation with exams, especially she talked about Christmas Eve and Santa and like the anticipation of waiting for Christmas morning, and that helped the therapist kind of come to the idea of maybe there's something that's going on in her life that she's anticipating, which ended up being her uncle's inheritance. So that anticipation is causing her anxiety and in turn causing her to have a lot of insomnia.
I think that's a great point. Yeah, I think memories are an extremely crucial aspect of this type of therapy and what they target. And do you have another possible element?
I would also say life.
In general.
Yeah, just like any other things going on. So she asked if there was a promotion at work or if she had any like exams or anything else coming up, which can also just increase her anxiety and anticipation and just make the whole situation worse. So there might be like the one main event that's causing it, but everything else can kind of make it worse.
Okay, yeah, I think that's extremely important as well.
The last thing I would say about this plan of therapy was that there was a solution at the end. So the therapist actually says like your problem is solved because she was able to figure out what was wrong and what was causing her sleeplessness and anxiety. So there was like a direct correlation between the problem and the solution.
Okay, yeah, 3 very important things. So next what I want to do is just zoom out on this so you can see your replies. And you can just kind of scroll down and up if you need to. Actually, you know what? We can just zoom out a little further. There we go. Okay, so using these elements, I want to construct a theoretical example. So suppose that I was a client coming in with depressive symptoms, and you were the therapist, and you had to target, of course, those depressive symptoms, and try and find a solution for this client. So what we're going to do is we're going to start off with the cognitive behavioral therapy, assuming that you were of that paradigm, and then we will go to the psychodynamic or psychoanalytic. So beginning here, I'm the patient coming into you. What are some of the ideas here? What are some of the things you're going to do?
Well, going off the cognitive behavior plan, I would ask if some traumatic experience had happened prior to the start of this depression. So, like in the other case study, she had lost some of her co-workers, if you want to say, at war. So maybe this person had, a death in the family or something like that where he felt he was responsible for it. So I would try to find what was really causing him to feel that way, and then kind of go through the whole situation of what happened and have him look at like step by step what happened and how he couldn't have avoided it and how if he had done something different, it might have been worse.
Okay. Is there anything else you would like to include here? Really targeting all three of these. So you did challenging cognition, which was excellent, behavior as well, and homework is the type of thing you would want to do, like, as well.
Yeah, so I would have him go home and just try to have him change his way of thinking about certain things, because it's easy to get fixated on one thought process on an event that can lead you to be depressed all the time because you're constantly blaming yourself for it. But if you kind of look at things in a different way, you can kind of take a step back from the situation and notice like these things happened and it couldn't have gone any differently, or it could have been worse.
Okay, yeah, I think those are all great points. And following that, suppose I was a patient coming to you with depressive symptoms, but this time instead you were a psychoanalytic or psychodynamic therapist abiding by that paradigm entirely, using what you think you, using what you extracted from the case study. How would you go about this?
So I would start with asking him if he's ever felt this way before, and what was going on in his life at that time. So in the case study, she had felt that way during exams and like Christmas Eve, just from all the anticipation. So if somebody came in and they were depressed, I would ask if they were ever depressed prior to this, and maybe if they knew what was going on, kind of try to find a correlation between what was going on in the past and maybe what's going on in their life now. I would ask them, what's going on now, if there's something major coming up, if something big just happened and it didn't go well, to try to find the direct cause. And then once I do that, it'll kind of cover the solution because you'll know what's causing it and you can kind of target that specific situation.
Okay, I think that's also great points there. And you can see the differences between the two, which really leads me to my next big idea here, the next thing I would like for you to do. So using your knowledge from the case studies, using your knowledge that you just displayed to me here, could you compare and contrast for me verbally the two different therapeutic paradigms?
So to compare them, they're both kind of looking at events that have led up to this point in the person's life, and they're trying to figure out what's really causing them to feel a certain way, and they're trying to better the person to help them feel better. But to contrast them, there's a lot more differences. So the cognitive behavior is looking more at a specific event or situation and kind of going through it and helping the person see what happened in a different perspective and helping them feel better about it. So there's really contrasting from the psychoanalytic plan, there's no like direct solution. They're just helping the person see, okay, this happened already, you can't change it, but here's why you shouldn't feel this way about it, and helping that person think about things differently. Whereas psychoanalytic is looking at, okay, what happened in the past and that made you feel similarly, so what's going on now that could also make you feel this way. And then by figuring out what's going on, you kind of come up with a solution of, okay, this is what's causing your depression or anxiety or insomnia, and then going on that to address those issues.
Okay, I think those are all great points that you have just made, and points like those extracted from readings like we just did. It's like you can read in the notes from the class the differences between the two, but looking at two legitimate case studies really displays the actual differences in the actual treatment of real people. And would you say, for instance, that if you had a patient, or if you had multiple patients of different possible disorders, that you think that one patient could maybe want to go to one type of therapy versus another patient possibly wanting to go to a different type of therapy, and so on?
Yeah, definitely. I think if somebody has had like a traumatic experience that they're blaming themselves for, so even if it's not like the death of somebody in your life, it could also be like, if a kid had his parents divorced, maybe they blame themselves, like they think they did something. I would say they would probably benefit more from cognitive behavioral therapy because they'll kind of think back to what happened and think about everything that led to that point and kind of see, okay, it's not my fault, I couldn't have changed it, or if I had done something different, it would have been worse. So I think that would benefit them better. And then for psychoanalytic, I think that would be better if it was for somebody with just symptoms that are caused by more something on a daily basis. So rather than like this, like not a main event that happened, but more of just like daily occurrences that make them feel a certain way. So constantly having exams or stress from work or just things like that, I think would benefit better from psychoanalytic because they're kind of connecting their emotions to what's causing it.
Okay, all right, that's a very important point. And just as a final question, really a follow-up here, would you say that they're, just in a all-encompassing question here, would you say that there are major differences between the two such that they can be distinctly differentiated from one another, or would you say that the two are really one and the same in the sense that there's just little minute differences but they fall under the same category?
I would say they're definitely different. You can pick out differences between them, but I think they would fall under a similar category because they're both kind of looking at things that have happened in the person's life and then trying to change their way of thinking about it.
Okay, so you think that there would be that there's legitimate comparisons that can be made between the two. They're not two wholly different objects, but in general, you would say that they're different in their functioning.
Yes.
Okay. Thank you very much for doing this. I think that that these case studies mixed with everything else really has highlighted the differences between the two, and I think that you showed an exceptional understanding of that.
Thank you.
Thanks.